Scrub is one of the personal protective equipment that are used by health workers in health environment. They promote hygiene and infection control. They protect the health worker from a potentially infectious fluid that could be found in a hospital or from a sick patient. They're also made in a durable material to withstand frequent washing and frequent wearing. They're also easy to clean, so that allows easy decontamination to protect the healthcare and the patient from germs or pathogen. They're also designed in a way that allows the health worker to move a wide range of motions that are required during normal operation of a health worker in an environment. They've got very nice pockets that would allow at least carrying of pens and maybe the equipment that a healthcare require while working in a medical environment. The guidelines by the WHO and the Center for Disease Control that advises or instructs a health worker on how to use scrubs. One of them is that they're supposed to be used exclusively in a medical environment and not anywhere else. This is to prevent transfer or transfer of infections from that medical environment to maybe outside to the public or to anywhere else. Secondly, they're supposed to be washed in hot water, preferably 60 degrees Celsius and above, with a medical grade soap. They're supposed to be used in company with other personal protective equipment like the hand glove, the masks, and the gowns. They're also supposed the clean scrubs are supposed to be kept in a designated area to prevent them from exposure to contamination. And therefore they're not supposed to be kept maybe outside in the bathroom or in your bag or something like that. But it should be a designated area where the prevention of exposure is taken care of. There are those of us who contradict or go contrary to this guideline. Some of my colleagues will find putting on a scrub from the medical area or environment, visiting the canteen where there are people there, even during in the public transport, you'll find a health worker from work putting on a scrub, or from home coming to work putting on a scrub. This is actually putting yourself, your family, your friends at risk of exposure to an infectious disease. You could be carrying an infectious disease from home through the public transport where you wore this scrub to the hospital where you are going to see a very delicate patient, and therefore a patient can get an infection that did not bring him or her to the hospital. Vice versa, you could also be carrying these infectious diseases to the public or to home to your family. And therefore, I would wish to remind my fellow health workers to stick to the guidelines that requires the use of scrubs so that we protect the patients and the public from potential exposure. Prevention is better than cure. And if you find this video useful, please tell someone, and thank you so much for watching.